I want to raise the looming crisis in the home care allocations as well this morning. I think we need an immediate debate on the issue, and for Minister Daly to hear the concerns of senators from all areas as to how the current shortfall will impact upon the most vulnerable in our society. We need to make provisions before this becomes a worse crisis. Currently, there are 6,000 people are waiting for home care support, and my Fianna Fáil colleague said it doesn't look good for the government, and it certainly doesn't look good for the government, and it didn't look good for Fianna Fáil when Fianna Fáil in Mayo cut 32,000 hours in 1 year alone. So it doesn't look any better now, several years later. There is a problem as well in it in terms of the recruitment and retention because of the social welfare restrictions. So if somebody does, say, 1 hour of home help in a day, then all of their social welfare payments for that day is cut off. And I really think that the Minister needs to look at this in how there can be some kind of set arrangements for home care workers to be able to do that without being pushed further into poverty. Because the fact is that they can't take up this work because they'll be worse off than before they had taken up the work. But news of the cuts ahead and that the health spending is set to overrun again this year are causing great anxieties in my community and in communities across the country. And it's hard to believe that yesterday we were here discussing a rainy day fund in order to deal with exceptional circumstances. Surely a looming crisis in how we care for those who need that extra bit of help should allow us to dip into that fund. The Rainy Day Fund legislation will be back again before us, and there will be a chance, Senator O'Donnell, to accept amendment from Sinn Féin, which will allow the same fund to be spent on crises such as this one. It costs the state €6,000 per week to have somebody in an acute bed, and it costs €160 if they can get the home care support package. Now, surely to God, somebody has to look at that and think, how can we save money here? You could save money for the health service that can be used on other vital things within that service. This represents huge inefficiencies. We've had entire debates in this House about inefficiencies and wastage in health. So it makes no sense that patients who are medically discharged are not able to go back into their home environment because a blunt instrument from the HSE says it has run out of money and cannot provide home care supports for them. So we need to hear from government that they understand the scale of the problem and to indicate that they will not allow the list for those waiting for home help hours to grow further. So reassurance and forward planning is needed to avert a completely unnecessary problem. I know the problem was created by Fianna Fáil, but Fine Gael don't have to continue on and do the same thing.